Okay, being respectful of everyone's time, I think we'll get started while the last few trickle in. The first few slides are mostly introductory anyway. So thank you to all of you who have joined. I know it's a busy time. November seems to be the most chaotic month for some reason as we move out of summer and quickly into the pre-holiday season. So thank you for making the time. So we felt it was important with all the things happening, in particular in health in Ontario, to give you a little bit of an overview and an opportunity to ask questions. Next slide, Taryn. So I'm Patrick Nelson. I'm a principal at Santis Health. Joining me today are Stephanie Gower, who is our Senior Director of Government Relations and leads our Ontario GR practice, and Kelty Gale, who leads our strategy and policy team. I can tell you, I could go on at great length about how amazing the two of them are, but I'll tell you that they're both exceptional and exceptional people and great colleagues and do exceptional work. So thank you to both of them for joining us. Oh, and Taryn Bratz is also on the line. She's helping organize all of these things and making sure the slides move forward, and Hannah Casey as well. So thanks to them. So I'm not going to tell you about Santis other than because there's enough here, and presumably most of you know who we are, but we are obviously a consulting firm. We have practice areas in government relations, both in Ontario and nationally. We do more and more strategy work, which is what Kelty is focused on. And then we have a growing communications and marketing group who aren't, which isn't a focus necessarily of this call. I think what separates us is just the people that we bring forward are focused on health, and our efforts are focused on health and life sciences. So not spread out over all of the other areas that the other firms might focus on. So a couple of housekeeping notes. If you have a question either now or as we go through the slides, please put it in the Q&A at the bottom. You'll see if you slide your mouse around, you'll see a Q&A log there. So put it there. We'll try to deal with them as they come, and we'll leave some time at the end to go through any that we didn't get to. Next slide. So we're going to walk you through a little bit on the long-term care legislation that's been introduced lately and is working its way through the House. The fall economic statement was obviously a pretty big showpiece for the government. And as we move into the election, we've got some tips and ideas for you on how to move things forward. Next slide. So I'll kick it off with just a little bit on the long-term care legislation. Obviously, this has been a showcase for the relatively new Minister of Long-Term Care, Rod Phillips. I can tell you that modernizing the long-term care legislation has certainly been on the to-do list for governments for decades, if not the last decade. And I believe was on the to-do list for this government. I think the language pre-pandemic was largely around modernizing, moving it into this century, it being out of date and old and so on. And I think as a result of the pandemic, some of the language and the narrative has changed significantly to words like strengthening, fixing, things like that for reasons which I probably don't have to share. So we can tell you that it seems as though the second reading will be finished today. It will be off quickly to committee next week. And presumably line by line reading as soon as possible thereafter. We do feel strongly that it'll pass before the end of the session. The government needs this to be done with so that they can get busy with the complicated process of drafting regulations. I heard just yesterday that there's up to 500 pages of regulations that need to be established. Some of that will be replacing existing regulations from the last legislation. Others are more complicated and will require consultation. And obviously the commission report has a number of feedback into that. Next slide. So maybe briefly, the legislation entitled Providing More Care, Protecting Seniors and Building More Beds Act It's also got a it's also been characterized as a Fixing Long-Term Care Act. It's got two pillars. Perhaps most importantly, it's enshrining in legislation the budget commitment to have an average of 4 hours of care per resident by 2025. That was obviously a significant, there's a significant funding component that goes with that. And maybe just as important, there's a requirement that the minister report regularly on the progress on meeting those targets. So we can expect post-election to see regular reports on how that's happening. Obviously, a big piece in the language and the narrative around enforcement and accountability. Perhaps overdoing it, but they need to be seen to be tough on long-term care based on some of the narratives coming out of the pandemic. So there's an expanded expanded residence bill of rights. There's a requirement to a right to safe support for caregivers and to be provided with care based on a palliative care philosophy. We expect details to come on the quality improvement plans through regulation. Obviously, there's been lots of conversation and tough talk around more enforcement and deterrence powers for government and inspectors. And a big piece on the communications front was just the doubling of fines and so on. And the minister hasn't given a whole lot of details, but the legislation affords him the ability to create a long-term care quality center. So we expect to hear more about that potentially in the budget next year, because one can imagine this is something that they would want to be able to showpiece or showcase as we move into an election. Next slide. So long-term care has been a pretty big focus. It was a focus for Ford in his platform. So that stuff is carried forward, and then obviously as a result of the pandemic, there's been a number of additional significant funding increases. So 30,000 new beds over 10 years. Upgrading older homes has been a focus and continues, although I understand some of that stuff isn't moving as quickly as many would like to see. We've certainly seen the accelerated long-term care build projects that a handful of hospitals are working on. Those things are happening in earnest, and it appears as though the Lake Ridge Health one will be delivered sort of early to mid next year. They've announced a doubling of the number of inspectors and increasing their powers to, with a higher focus on enforcement. And of course, the thing that I think we hear most about, both from operators and folks in the healthcare sector, is just the real significant challenges that are coming with HHR. And we'll talk a little bit about that through the fall economic statement report. Next slide. So I'll pass it over to Stephanie to take us through the fall economic statement.
Thanks, Patrick. And just a reminder, if you have a question throughout these slides, please use the Q&A chat function at the bottom, and we'll try to address those questions as we go or at the end. So I think we've had 10 days to sort of review the fall economic statement that was released on November 4th. 3 pillars that the government is sort of outlining their path forward: protecting our progress, building Ontario, and working for workers. No surprise, the primary focus is recovery from both the pandemic and the effects to the economy. And we're seeing significant commitments and an overview of the commitments already made, specifically in infrastructure, building roads, highways, hospitals, and the government providing sort of improvements to healthcare and the sector with investments in home care and a bit into mental health and addictions as well. And as Patrick mentioned, prior to the FES, we saw announcements that focus on sort of strengthening the healthcare workforce. And, I think we can continue to see that trend continue with further investments on upskilling upskilling for hiring nurses and PSWs. So I don't want to spend a ton of time on what was in the FES, as I think most of us have had a chance to review it. But we saw limited new spending beyond what the government has announced in the last sort of 20 months. I think the biggest chunk of investment was into home care sector, and 548 million over 3 years for increased capacity. And, you know, I think this is one way the government sees sort of a way to alleviate the mounting pressures in hospitals, and the way to manage the sort of the wait lists and the surgical backlog right now. Next slide, Taryn. And as Patrick covered, you know, substantial, obviously, long-term care focus and investments. They continue to maintain their COVID-19 supports for funding in both the long-term care sector and the retirement homes and other congregate settings. And we saw an announcement in terms of the wage enhancement as well, continuing that till March of 2022. And I think there's, you know, there will likely be some questions on that as well. And next slide, Taryn. I think what I really want to focus on is sort of what was missing from the FES. No mention of digital health or virtual care. No mention of public health, which was absent in, I believe, last 2 budgets as well. And really no mention of Ontario Health or Ontario Health teams. And I think, you know, upon sort of further reflection and analysis, I think it's safe to say that the government is actually having a hard time spending money in healthcare. You know, in the budget in April, they were projecting that 2021 spending would be 66.7 billion, and you know, an additional sort of 20.1 billion for COVID, and now they're saying they've spent 64.4 billion and 19 for COVID, and that's more than the 3 billion they were planning to spend but didn't. And for health, you know, they're projecting an increase of about an 8.5% growth, and that's a sizable amount. But when you review all of this, it seems that sort of they're having trouble spending their full healthcare budget for at least the next year or two. And there sort of is this notion of excess funding for the system for a while. So I think that it suggests to a lot of us that there is room for those trying to make a pitch to this point, you know, pitch to government for whatever your organization is advocating for, and you know, trying to sort of fit that into the sort of main questions we have here on the slide as well, looking at sort of healthcare commitments to ending hallway medicine. How can we support the government? How can your organization support the government in tackling the surgical backlog? And we'll get a bit more into that, but I think that it's just important for context setting as we get into sort of the next slides with the election and sort of budget asks. And I'll turn things over to Kelty to go through the next sort of what the next sort of 6 months look like.
Thanks, Steph. Taryn, next slide, please. Thank you. So here we've got the key dates that take us from here to the election. The legislature is rising December 9th, and then we'll be back February 22nd. So after that, we'll be watching for that spring budget, anticipated to come mid-March, like they typically do. And Steph's going to outline for us in a second some of the reasons why this budget is so important and so significant, and also what you can do to influence and feed into it. But really, that is a big milestone here to watch for. And then it'll be finalized, that legislation in April. The legislature will rise, and we are anticipating that the writ will drop on May 5th, and that will be the start of the election campaign for 28 days. So running throughout May, and then with election day scheduled for June 2nd. After that, it takes a little bit of time for cabinet to be put together, and we won't see the legislature return until September. So really, you've got this break between April and September before the legislature returns. Next slide. During that election campaign period, the bureaucratic arm of government will go into caretaker mode and function in this custodial manner where they're not prohibited from making decisions, and they are definitely expected to maintain the daily operations of government, but they're supposed to focus on routine, uncontroversial, or urgent business. So an example of what is considered urgent business from the federal election in 2011 really gives you an idea of what fits into that category. At that point in time, Cabinet was grappling about what Canada's role should be in the NATO operations in Libya. And the Foreign Affairs Minister wanted to attend international meetings that were taking place during the election campaign. So what they did, because this was considered urgent, was to ask the opposition and to get their agreement before attending those meetings, because that committing any future government to participating is really considered outside of that caretaker role, but it was considered urgent business. So typically the government during that time will defer any major policy decision, any change in the policy direction, new spending or announcements that will commit new money, and really anything that would be difficult to reverse without cost or disruption. So the fundamental principle here is really to avoid binding a future government as much as possible. Next slide. The practical implications of this, when you're looking ahead to this May time period, is that if a major decision has not been made before the beginning of that election campaign period, and really well, in that budget period, you're not likely to see movement until the incoming government is in and has settled. And that period may stretch out a little longer if there is a change in government. They tend to keep staying in a little bit of that caretaker mode while a new government comes in. So if there's a change, then that takes a little longer. During that time, ministry staff are unlikely to engage in anything that's not considered routine business, and they may even defer certain things that others may consider routine business. So regular meetings, they may just choose to defer them until after the election. And there will be limited public announcements, both from the government and government agencies, on strategic and operational items. People are very respectful of this caretaker mode role, and are already planning for announcements and for any major activity to happen before or after, and to avoid any new announcements, new plans, new strategies, even if they are in line with the overall direction, preparing to hold those announcements until before or after. Steph, back to you for what to watch for.
Thanks, Kelty. Next slide, please, Taryn. Thanks. I think many of you have participated in our webinars in the past, and we like to have, sort of the polling of the day, but I'm not adding that here because I think that there's no point in speculating right now. A lot can happen in 6 months. We're still tackling the pandemic and vaccine issues and booster shots and what wave are we in right now, and vaccine requirements and all of that. So as I said, anything can happen and a lot can happen in 6 months. But I think it's important to sort of look at what's on the agenda right now and how is this going to influence the platforms for the major parties. The key sort of pieces out of the fall economic statement for the Conservatives, looking at building infrastructure, the highways that have been announced in the last few weeks, the minimum wage increase, and particularly, I know we have a question that we'll address at the end about the HHR, or Health Human Resources crisis, but looking at ways to protect sort of the system and bring in and train new nurses and PSWs. I think everyone has seen by now this sort of advertising campaign that the PCs have launched and calling themselves the party of yes. They're saying yes to infrastructure, yes to funding important projects. And I think that's, sort of the tone that will carry them into the election. I think there's a lot of pieces though that could potentially detract from their sort of themes that they want to be focusing on. So, it was in the media this week that they're looking at polling right now for how Ontarians want to see a plan to tackle affordable housing crisis. Where's the childcare deal with the federal government? Where are we at on sort of fair share of the Canada Health transfers? The LTC national standards development, where a lot of us are aware of that process. How does that impact sort of the discussion? And, when you look at sort of the NDP and Liberal focus, where does the sort of for-profit versus nonprofit issue, and how does that project upon the government of the day? So a lot, as I said before, a lot can happen, and there's a lot of other sort of pieces that can detract from the current themes and messaging that the government would like to focus on. Next slide, Taryn. So in terms of setting up your organization for success, and I know we work with a lot of you on the phone today, but I think everyone knows this, but budgets are sort of the most significant piece for the government to focus on. Outlines the fiscal spending for the year. But in this case, in 2022, it's also going to outline sort of the election platform and plan forward, especially for the Progressive Conservatives. If they are reelected, those pieces outlined in the budget will be part of their long-term agenda. So I think, next slide, Taryn, getting into sort of the effective budget, what makes an effective budget pitch is really important for organizations to be planning right now and be prepared to advocate over the coming 2 months, really. So looking at what the government, the problems that you are trying to solve as an organization and what the government is trying to solve, and how the two sort of relate to each other. How your organization is in a position to support the government. So I think, if you're thinking about infrastructure, LTC or rapid build, surgical backlog, jobs, I think we're also sort of always focused on the infrastructure and those pieces, but jobs in the economy is so important for the government and will be a sort of cornerstone of the platform. So how can your organization solve any of the problems that they see right now, and why are you in the best position to support them on this? So I think, a lot of this, everyone on the phone knows, and I think we're happy to share the slides after as well. But connecting sort of your asks into government agenda right now, has the Premier or the Minister said that this is a problem, and do we expect this to be a focus of the party platform? Trying to keep all of that in the back of your minds while you're working on your budget, your budget pitches. Next slide. So I think we want to spend a bit of time here talking through sort of the positioning of your organization and sort of how everything is going to be focused on the election. I think it's no surprise to most of us that everything is very controlled right now in terms of government announcements. And the rollout from the fall economic statement. The Premier's office is controlling most of that, and the plan is sort of being built right now for the election. Obviously the budget is a piece of that, but for the election and the next, I would say, year. So how can your organization sort of take the next 6 months and focus on the objectives you're trying to achieve? And there's a few points on this slide that I want to touch on. We're coming up to the holiday season and the legislative recess. The legislature will rise on December 9th, and right now it's not scheduled to resume until February 22nd. That might change, especially if there's any sort of urgent business, COVID related or otherwise, that the legislature needs to be recalled. The legislative break is a great opportunity for organizations to advocate with MPPs while in their ridings, making the connection from your organization with sort of that local lens on everything. Re-election for all MPPs is going to be top of mind. So using, if you're a sort of a membership-based organization, using your members in the local constituency to have those meetings with your MPPs that you're trying to target. Drill down and try to look at the local issues. What does this mean for the riding? What does this mean for that MPP on election and re-election? And have they done enough on the particular issue you're looking at? And how can you support them in that? I think using the sort of break time is, we're often fixated on sort of the budget process, but having that local connection, especially in an election year, is so important. I think, in terms of budget consultations, the FES outlined that the consultation period is technically open. You can submit your documents now to the Ministry of Finance through the online or through email or writing. There's no online portal up just yet. And the consultation process is going to be, I think they signaled it would be unveiled in the next sort of 2 weeks. So as we await those details, thinking about the budget asks and making sure you have sort of all of the boxes ticked on your budget asks and giving yourself enough runway to have substantive conversations around your budget ask. Let's not wait for January to start on these. Submit your asks early, leave yourself a longer runway to advocate, again, at the local level, at the consultations, at the ministry level, and try to tie those asks back to government agenda as best as you can. And I think one thing that we often miss is, using government's own language in those budget asks. So key buzzwords, modernization, those types of things. How is the government communicating about that issue right now, and using that language in our own budget asks? And then I think also having sort of key succinct messages and those easy sound bites for local MPPs to remember. They're constantly asked from the local level by the Premier's office or the ministry, what are the key issues in your riding? This is ongoing, but this is going to sort of ramp up even more so before the election. And MPPs are going to be advocating around the caucus table for sort of local issues. So what's the soundbite that you want them to have in the back of their mind when they're at the caucus table? And then, if this is applicable, using personable, patient-focused stories, local stories, case studies, testimonials, those types of things. Who is this funding actually helping? And at the local level, tying it back to a story or a testimonial is one of the best ways to do that. And incorporating that, I understand in 500 words or less is often difficult, but sort of the surrounding materials that your organization is developing to share the budget ask, having that incorporated in that is really important. So that's it for our slides, and we're all happy to take questions. I think there are already a few questions. So if you have anything that you'd like to ask us, please enter that now into the Q&A function. We already have one question, and Deborah asks, how likely will it be that this government will work to develop a more comprehensive HHR plan across silos in healthcare? The LTC HHR planning is clear, the rest is not. I think that's a great question. And Patrick, I don't know if you want to jump in here on this. I think it is clear that the LTC sort of piece of it is a big focus for them. But advocating and depending on your organization, the needs of your organization, and making it very clear and apparent to the government that there's this problem everywhere, and coming up with sort of your solutions and how your organization can support the government in this, I think is crucial, and now is the time to do so. But Patrick, I'll turn it over to you.
Sure, thanks, Steph. Happy to add a few points. And you touched on a few, but I think first and foremost, there's a national health human resource problem that other jurisdictions are wrestling with as well. Quebec's got a giant problem. So the government has obviously been a little hyper-focused on long-term care. given what's happened in the pandemic. I think if you talk to the long-term care operators, they are perhaps just as concerned as anybody about access to PSWs and nurses. Getting people to get back into community care is a challenge. I have heard anecdotally that there are those who believe that, you know, newer graduates, PSWs, nurses, and others are less likely to want to work, you know, the same 40, 50 hours with one employer. So many of them are moving to agency type work. So I think the whole health system is grappling with this problem. I take the point that there's a feeling or a sense that home and community care is going to be negatively impacted the most by a focus on long-term care. But I'll tell you, the long-term care folks don't believe that what's there now will accommodate what they need to do now. They were already wrestling with HHR problems pre-pandemic, and the reality of these new investments to move up to 4 hours of care over the next 4 years means that they're going to need that many more people to do that work. So I think we'll see lots of conversation about this. I think there's probably a place for Ontario health teams to start to think about HHR distribution in their communities and where it's needed most. And maybe perhaps lastly, I have heard you know, some of the Long-Term Care Act language is concerning to the long-term care folks, because just the punitive measures and the punitive language that exists is making it hard to recruit and retain people in that sector as well. So I think it's a challenge, and I don't think it's going to go away before the election. I think it's going to be around for years to come.
Thanks, Patrick. I think that's actually a good segue into another question we have. And Kelty, maybe this one's for you, but do you have any sightline at this juncture on the government's plan to accelerate or not OHTs post-election?
I think we can expect that the government is going to stay the course on OHTs, especially if we have the same government. I think we could expect an acceleration of the OHT agenda. I think even if we do end up seeing a change in government, the integration agenda has been around for decades now. It goes by different names. It has slightly different priorities, but I think that integration agenda is likely to continue and accelerate. There are OHTs who are gaining momentum now, and I think that it will be both driven from the government and also driven from those local teams, the way that was envisioned when this policy was first put forward, that they are now coming together. They're starting to do some of that collective planning, collective prioritization. The big outstanding question for OHTs is what the budget integration and funding integration will look like. And I think that is going to be an ongoing question. But I think the integrated planning and actually working together will definitely continue and is likely to accelerate post-election and hopefully post-pandemic, as we ease out of this particular time.
Thanks, Kelty. And maybe one other question for you that came up, and I'm happy to add on to this as well. Can you share your insights on what we may expect in community mental health and addiction sector? Kelty, anything you want to take there? And then
Steph, I think there's a lot of potential in that sector, especially with the new Mental Health and Addiction Center of Excellence that is less new now, but is a bit more established and starting to really set its priorities and figure out what that's going to look like across the province. So many of the OHTs have mental health and addictions as a priority, that I think those two pieces are actually quite closely tied together of what community mental health and addictions will look like, and what the OHTs are going to do. The government has a focus on this, and they keep making the announcements about the funding. And I think we don't expect that focus to go away. Steph?
No, I think that the government has been clear sort of on their roadmap to wellness, and then further investments in this space in the last fall economic statement. I think it is a priority, especially given the pandemic. But I think if there are substantial sort of local issues, and on a particular riding or a few ridings, Deborah, that you are focused on, then having those conversations now with the local member, especially if they're a government member, would be prudent, and to continue to escalate sort of those local issues with them. Patrick, maybe this one's best suited for you. Given the HHR crisis, the role of family caregivers will continue to be an important role. How likely is this government to support policies that support caregivers?
Yeah, I perhaps we glossed over some of this in the legislative update. There's certainly lots of language around caregivers and their import in long-term care and community care in the Long-Term Care Act. Will that translate into more action? I would guess so. I think the early response to the pandemic, which kept those caregivers out of long-term care and elsewhere, I think was on reflection or looking back, I think everyone knows that was a mistake, because they're so critical to the quality of life and the comfort of life that seniors have in long-term care. But they're also an important accountability piece, and they're an important ingredient in the care continuum. So I think we'll probably see more and more conversation around that, and I think we'll see organizations advocating in a stronger way for a bigger and more important role for caregivers.
Patrick, this next question is for you as well, and I'm not sure if you can see it, but Richard is asking, what approach would you suggest be used to have the government reconsider their position and focus on heading further towards approving profit long-term care homes?
Yeah, it's a tough question. There's language in the legislation that is focused around mission-driven organizations. So that's an effort to have those organizations put missions forward, be accountable different way. I think there's lots of accountability conversations that have happened in there. I don't know that I have the answer to that question. I think there's lots of data that supports that the ownership model had little to do with the outcomes in long-term care. And I know there's big debates about that. I think the commission spent some time on this particular piece, and that's where the mission-driven focus comes from. I think we'll absolutely see the opposition continue to make the case that those things were responsible for the impact in long-term care in the pandemic. I don't think this government is too seized with that, in part because of the evidence, in part because they would like to move on from long-term care. And I think much of what has been talked about in over the last few months just around long-term care is really about insulating themselves as we move into an election. They've certainly got a long shopping list of bullets now around investments in HHR, around investments in new buildings, new beds, rebuilding old beds. So will that debate continue? I expect so. But I think we'll see this government doing whatever they can to move on from that conversation. I think it's important to note that the narrative around fixing long-term care is largely about their key message, which is that what happened in long-term care was a reflection of decades of inaction in long-term care. And we can have that debate, and it'll happen. But those are my thoughts for now.
Thanks, Patrick. Just looking at the time, if there are any other questions, please share them through the Q&A. And most importantly, we're all here to assist. And please reach out to your Santis lead if you have any questions about this presentation. Again, the slides will be available after this, and we'll be sharing a survey with all participants as well on this webinar. Yeah, just do one last call for any questions. Patrick, Kelty, anything else you'd like to add?
Just a big thank you, and we, us political folks love watching the silly season as it comes, and it's going to get sillier, and it's fun to watch for most of us, but it can be a grueling exercise for everybody else.
Thanks to all of you for being here.